Good morning, all. This is Colleen Joy. It's early on Wednesday morning, about 7 o'clock. I am coming to you raw and ready. I'm in my robe. I just got up and I was looking at a few things on Instagram this morning, and I found this beautiful video rendition of a family welcoming their baby. And it is a home birth that eventually ends up in a cesarean. And I just was emotionally moved, and here's why. My gratitude goes out to the family for wanting to share this with everyone. It was a beautiful home labor and a simply beautiful, compassionate welcoming of their baby, although they did need to move to the hospital. And I think that's one thing to say, that having a home birth does not mean that a hospital birth might not come into play, and certainly not a cesarean. But it's a beautiful opportunity to work with midwives and to have a journey that you know is progressing in the way that it needs to. So I want to just celebrate the family and the beautiful labor and birth that they had, their sweet, beautiful little baby. What I want to take this to is something that emotionally was so challenging to me, because the birth was going as it needed to. And I was watching that and very much celebrating and honoring this, what we call the Purple Heart in our practice, of having to change plans and refocus a parent's energies and really welcome their baby in whatever is the best way for that particular baby in labor. But what occurred from there is this need, if you will, for the reminder of hospital staff. And I want to send this out to all of you, that perhaps you can share this with more people, that it will reach more hospital staff members, because the treatment of the baby and how that occurred once the baby was born is the part that almost overwhelmed me. When this baby was brought into the world, there were beautiful pictures that will be a wonderful memory for this family and this baby, of coming from its mother's womb and out into this world. But then once it hit the warming table, and the amount of drying and suctioning and the firmness of back padding with a baby who was doing well, and then the wrapping up and barely being able to let a mother even touch her baby. This mom had to keep scooting her head to even touch her baby's cheek. There's no method of safety. There's no problem with sterility. There's no time frame that is interrupted in a staff to just create simple ways of maintaining compassion and respect, and maintaining the connection between the mother and the baby. So when this went on, Daddy got his skin to skin, which was beautiful, and the hat stayed on. Hats are not ways of allowing people to explore and touch and stroke a baby. Hats are another barrier. Keep the hats off. Then when the mother was back into the room and able to hold her baby, she looked joyful and excited, and I celebrate that. What I don't celebrate is the way that the staff handled the baby. The staff handled the baby by one hand underneath the baby's back, so the baby was arched out, and they were holding the baby like that, while the other hand was pulling on the mom's gown, pulling the towels down, pulling the blankets down, and this baby was laid arched out and then plopped on this mom's belly, which this mother was elated to have, and I'm so grateful that they were skin to skin again. That part of it I celebrate. It is the treatment of the baby and their experience that they are going through, because they deserve more respect. They deserve more compassion. It does not take away the staff's time. It does not cause problems with sterility or with cleanliness or with their schedules or with medical technology, nothing. It is merely slowing down, handling the baby with compassion, and then bringing the baby onto the mother with compassion and love and joy and tenderness, to then, again, put another hat on the baby. The mother has not smelled her baby, kissed her baby, enjoyed her baby, had that moment of envelopment yet. It is so important that we maintain that opportunity regardless of the method of birth. I don't care whether it's a planned hospital birth, it's epidurals, if it's a cesarean, I don't care what kind of birth it is. We need to maintain respect and gentleness and compassion for the newborn and the mother's ability to reconnect, to rejoin with compassion. So I celebrate the birth. I celebrate every person's birth and that opportunity to become a new family. That is beautiful and whole. And yes, I talk about normalness. I talk about ways to be able to keep that normalness in our in birth, and when I do my lives, my classes, and everything. But I understand as a midwife, there are going to be situations that require medical interventions, transfers, and yes, even a cesarean. Sometimes a baby even goes to the NICU for some reason, and I understand these. But we must look out for the baby and the connection between mother and infant, and maintain what is important for them in this journey. It does make a difference to the newborn. They are not a being without feelings and memory and understanding. They are embracing every single moment that they are taking in as they are being born, how they are being treated, and how they are being welcomed into the arms of their parent. Yes, one of you said, I will never forget how I felt as a 7-year-old girl when I saw my brand new baby brother be handled so disrespectfully and harshly by hospital staff. I was wide-eyed and I knew something was wrong. You know, when I was going through nurses training, babies were all born in a delivery room. This was back in the 80s, and I had never been exposed to birth, let alone raw birth, being actually at a birth, until I was in nurses training. And I was being trained as a certain way, but inside me, there was something that said, this isn't right. I don't know why I feel that way, but this isn't right. And this was a mother having her 5th baby, wheeled into a delivery room. Her legs were put up in stirrups, drapes were put over her. Everybody was in surgical garb, including myself. Her hands were strapped down to her table with leather straps. And when her baby was born, something instinctual in me, never having been taught, never knew anything. I wasn't a midwife. I was a lonely student nurse. I undid her hand and I took her hand and I said, touch your baby. That to me was a beginning of understanding that I had a purpose that was going to come forward. I didn't understand it at the time, but I certainly knew after time went on and I became into midwifery that something was cluing me in to the real heart and soul of what needed to happen here. So this morning, as I was watching this, as I said, I embraced. You can go and you can watch it. It's called Home Birth Cesarean. I want to celebrate that this family had a beautiful home birth labor that moved into a hospital because it was needed, and a cesarean that was needed for a healthy mother and a healthy baby. And just say to all of you, if you are hospital staff, if you're doulas, if you can talk to people who are planning hospital births, put something up in your room that says, please be respectful to my baby. They are part of me, and I need them to be respected. If you are someone who attends a birth, look for this and remind the staff, and do it with what we call honey, because you get bees to go for honey. You must say to them, thank you for being so kind and compassionate to this baby who has been born in a way that a mother did not expect. Thank you for your compassion. Thank you for your respect to making sure this mother can touch her baby and kiss her baby, because the staff will throw you out if you do any other way. Now, I was a nurse, okay? I understand the whole regime, but I never worked labor and delivery, and on purpose I didn't. I worked pediatrics instead. Another person in today, I had a very traumatic hospital birth with my daughter. I wanted so bad to have a home birth for our next. Not sure how a previous hemorrhage would affect me in that decision, though. Don't let that steer you away. That is something that if your iron's well and you look at situations and you have a good qualified midwife who has medication on board, you can always do what's called active management. And that is that you already know and have agreed with your midwife to do active management, which means as the placenta is coming, and remember that at home we are not pulling placentas out before they detach. When you do that, you cause more bleeding. So placentas start to detach, placenta comes, and active management means we make sure placenta comes, and you usually are given a dose of Pitocin and or Cytotec to be actively managing to make sure hemorrhage does not happen. So don't be afraid of opting for a home birth. That is not a good reason not to. Oh, Jenny Miller, hello, sweetheart. Boy, whoops, okay, down. So I, this morning in seeing that, I thought, do I wait till 7 o'clock tonight to talk to you all about it? And I just wanted to cry. I just wanted to cry. And, you know, I think watching this birth and the disrespect of this baby, when many people would look at it, they may not see it to the degree that I did. But I you know, doing home birth for so many years and knowing that when these babies come up into these mothers' arms, and forgive me for the word of mother if those of you do not identify in that way, I do mean birth giver. It is knowing that that baby comes up and is enveloped into that mother's arms, and the respect that is created afterwards. Even when I have to initiate resuscitation techniques, these babies stay in these mothers' arms and I talk to them. I say, that's it. You're doing a great job. I know this is big, but your body is doing great and your lungs are opening and you're doing so well. You know, and I've had families say, gosh, we hardly even knew that happened. It didn't feel like there was any trauma or anything going on. I said, because it wasn't trauma. The baby needed help to be able to breathe. So I was doing for the baby what the baby could not do for itself at that moment without having to sacrifice all the other things. You don't have to cut and clamp a cord and take a baby away from a mother to do resuscitation. Now, in a hospital setting, sometimes these babies are very depressed because they've had a lot of medications and drugs and all of etc. But I believe that the umbilical cord is the baby's lifeline, both spiritually and physically. And it needs to be left alone, if at all possible. But oh my goodness, I just couldn't take the back bend. And I was almost in tears. So I'm like, I'm going to get on. Yes, I'm in my robe. I'm in my jammies. I'm in my home. I'm in my glasses. I don't have my contacts on. This is raw, right? And that's what birth is about. It's about getting raw and real. And it's about being uninhibited and being your true and authentic self. And when you do that, you can maintain what needs to occur in the 98% of the time. And I say that because when you look at my statistical wall, many of you have asked about my wall, right? I mean, I do my lives at night every Wednesday at 7 o'clock. They're in my office, and you see my wall behind me. My wall is a representation of all the births that we've done, okay? And my wall says each and every baby that's on here has their name, a special bead that reminds us of the family. And I'm gonna try and show you, okay? Let me turn the lights on here. These beads are a representation. These are the families who have chosen to have their babies at home. Now, not everybody can have their babies at home because of various health reasons. Sometimes it's financial, sometimes it's distance. But if you look at these, on the top there's a blue bead. These are all water babies. Occasionally there's an extra pink or blue, that's grandbabies. And on rare occasions, let's see if I can find one here. On rare occasions, you're going to see a purple one. A purple one is what we call that Purple Heart I was talking about. And that's a family who had to change gears because the baby needed more support and more intervention to be able to be born, and we went into the hospital. Now, how many purple beads are you going to see up there? You're going to see about 1 or 2 in 100 babies. That's 98% of them are having normal, natural, non-interventive births, or at least are able to have the minor interventions at home. It might be a few puffs of air. It might be an injection for bleeding. It might be, a longer labor support, right? Okay, so there may be tricks of the trade that are being used at home, but these are not families that have had to go into a hospital for intervention. So I want you to really seriously look at that. Now, not every midwives have the same statistics as we do, and that's another story. But understand that so many of you can opt for less intervention if possible. If you're going into a hospital, you take a birth plan. It has no more than 10 bullet points on it. You put the 3 most important on a piece of paper and you tape them up to the wall ahead of you so that all the staff and all the doctors see what is the most important thing for you in this birth. All right, there's somebody said, is there any way to transport you to Salt Lake for a future birth? Well, actually, I'm going there in May to do 2 babies for nieces, and they do live in that area. But I want you to know there are amazing midwives in Salt Lake. All along, there are tons of midwives in Utah, all up and down the 15 corridor. Not as much in the north, but there's a midwife in Logan, even though Logan's a very small little place, but there's a lot in Salt Lake City, down in Provo. There's tons. I think that same thing to Beth. I'm from Salt Lake City too. That's so cute. Hello, everybody. I wish every midwife was like you. You know, Emma, I thank you so much for that compliment. I really appreciate it, and I do understand that, each midwife has their own personality, their own philosophy. Direct entry midwives are often a bit different than certified nurse midwives. And I think the thing to remember, and I say this to families who come from my area that have had us as midwives, who move to another area, and they say, but, we won't have you as a midwife. And I say, I'm so grateful for the heart and the relationship that we have, but I want you to remember where birth is. This is what I want everybody, and I do this with our families. I want them to know that they can give birth anywhere, regardless of whether we're there or not. Now, I get, the personality side, and I understand that. But birth happens in you. Birth is who you are. It's your authentic self. It's your rawness. It's your uninhibitedness. And it's your power, your strength, your wisdom that gives birth to your baby. And what a midwife does is hold space around you for that trust and brings the safety equipment should the baby need a little help to jumpstart. Should you need some help to keep you safe so that bleeding doesn't become an issue? Should you need to be assisted with a transfer? Should you need some wisdom during labor to help a baby who maybe is in a funny position or something to get repositioned so they can be at home? Remember the role that you have and the role that the midwife has. Now, some are more medicalized, more interventive in their prenatal sometimes. But remember who is the giver of birth. It's you. It's not anybody else. So I want to really bring that to you. And if I somehow give you that strength, that courage, that power, then I want to remind you that it comes from within. And when you're going through labor or you're going through birth, and there's some little voice from me that says, remember, you are powerful. You are amazing, and you can do anything you set your mind to, because I believe you can, even if that means you have to transfer and you need a cesarean. You can do it, and you can use your voice to tell them what you want. I want you to be kind and respectful to my babies. Babies, sometimes it's twins. But when you go into a cesarean, look at the staff. Just say to them, please be respectful to my baby. I know you will do what is best and help my baby get back to me skin to skin in the OR, in the recovery room, and that you will treat them with kindness and respect. No one can argue with a mother's request like that. But I think sometimes we forget to remind mothers they can respect that. I consulted with a person the other day over the phone, and this is a very real statement that I hear. When you walk into a hospital system, you feel like you have given your voice away. And I'm so sorry that that occurs. But it does. So it is with reminding you that you still have a voice. You can still request. You can still ask, even when technology has to be pulled into a birth, what it is that you want. And help if your voice is maybe not as vocal there, because labor takes you inside where your voice isn't wanting to be talking to people. It wants to maybe sing a song, but it wants to be inside, having the conversation with birthing the baby. And sometimes you need that outside person to remind you that you need to use a voice in order to, in a hospital setting, ask your questions or voice what you want. I want to bring her to Michigan. Michigan I've never visited before. I'm in Salt Lake too and would love her to come here too. We are trying to get pregnant but aren't yet. Is it too early to start looking for a midwife? No, it's not. You start looking for a midwife and have the opportunity to interview with them and find out who works for you, because I know for us, being a well-established midwifery practice, our practice would always fill. I mean, when our clients would get to be 4 weeks and they took a pregnancy test, they knew they better call us that day because our schedule would fill so quickly. And we always want to take repeat clients if at all possible, and then add to that with families who are looking into it for the first time. So it's never too early, and it is never too late to change gears. Now that means from midwife to midwife. It's never too late to change midwives if something is not working. Because if there's something that's not working, then it's going to get into the birth. And you have to change. It's never too late to change doctors. Okay? So don't hesitate. I mean, we've had women this is very rare circumstance, had a woman in labor who, decided to change gears. But usually it's at least a few days before. Most of our families who come on at a late add-on, if you will, do that within 4 weeks to 2 weeks-ish before they have their babies. Now, some midwives are not comfortable with that. By making sure that we feel comfortable with the circumstances, sometimes it's a family who just realized that they want something different. And if their circumstances are well and we feel that they're a good risk, then that goes forward. And for us, in our practice, we have always had very fast, good, easy births on those families who have made late changes because they realize that's really what they want, which means they're going to do everything to make sure that goes forward in every way that they can. So never too late, never too early. Thank you for this. You definitely empowered me. That's what I want. I want you to feel empowered. I want you to know that you are the givers of birth. Most of the midwives in my area are employed by the hospital. Is this common most places? No, Emma, it is not. In fact, most of the midwives are not connected with a hospital because hospitals, by their malpractice and sometimes the law, cannot have them doing births inside the hospital and outside the hospital. Now, if the midwives that are in your area are employed by the hospital and they work only in the hospital, yes, that can be common because they're usually certified nurse midwives. This is wonderful when you have hospitals that have certified nurse midwives. It used to be that many of our hospitals in California did. Then there started to become something that pulled them out, and they were only put in the clinic for 9 to 5 visits where the docs were now doing the deliveries. And what happened? The cesarean rate went up. So some hospitals, remember that hospitals' revenue comes 40% from labor and delivery, which means if they're not making enough money and midwives have lower interventive births, which means less cesareans, less epidurals, less money for the floor, the hospital may choose to not have them work so much. Now, Kaiser, that's here in California and Utah, a few other places, they employ midwives. Why? Because it's advantageous to how they set up their financial circumstances to hire midwives instead of physicians to do the majority of the work, because they do have less interventive, so they have less out of pocket. So that's where you'll see that. Licensed midwives, certified professional midwives, don't get those two mixed up. A certified nurse midwife means she's gone to nursing school, then she goes into midwifery school and is trained in a medical way. It doesn't mean that there aren't some that practice in a home birth setting who have transferred over, but that's more rare, and some that practice in a birth center that's outside of a hospital. That can be more common. But a certified professional, a CPM, is more common in some of the other states in the United States and in other countries. And they train direct entry, so they practice outside of a hospital. It is almost unheard of that a licensed midwife or a certified professional midwife would have privileges in a hospital. Yes, they can transfer with you as your support person, but you then are now part of the hospital staff. Whoever the certified nurse midwife or the obstetrician is, if you transfer in. It doesn't mean that you cannot have a hospital birth that goes extremely well. You can, but it's still going to be a hospital birth. So you have to understand that. You're still going to leave your home, which is the first intervention. You're going to go into a hospital. They're going to ask you to put on gowns. That's the second intervention. Don't put on their gowns. Wear your own clothes, okay? You don't have to be in a hospital gown. It's not magic that's there. Maintain your autonomy. Take your own pillow. Take your own blanket. Yes, they may get messy. You have to be okay with that. But I also say, when you want to change positions in a hospital setting, change positions. Get on your hands and knees. If that's how you want to deliver your baby and everything seems to be going relatively well, you're having a normal labor, do what your body's telling you to do. If the staff's not used to it, they will get used to it. Guess what? The baby's still going to come out and everything's still going to be okay. So follow your instincts. And that's why sometimes having a doula in a hospital setting is essential. They will help encourage you to follow your instincts and help you to remind you of what you wanted. Your sweet partners are there for that too, but sometimes they're emotionally involved with you so much that they can get caught up in the, let's say the suggestions of sometimes, well, you know, it's really best for the baby if you're on your back. Well, it's not best for the baby. That pushes on your large arteries that are in your body. That causes your blood pressure to go down. It defeats the purpose of gravity. And I can tell you at home, when women are left to themselves, and again I say women, meaning birth givers, are left to themselves, most of them will birth on their hands and knees. Some will squat. Some will birth on one knee and one leg up. But nobody chooses to birth on their back. Now, on rare occasions, we have had to have babies do that, only because for whatever reason, that baby's way that they're making it through the bones needed to get under the pubic bone in a different way because of that mother's pelvis, but that is rare, okay? All right, so I'm back to respecting the newborn. Respecting the newborn for their experience, their compassion that they need to have, the respect, the gentleness, the understanding of their body that's been in a curled up little position, that they are learning touch, they're learning air, they're learning to trust the world. So I'm encouraging all of you to do all the things that you can to plan in your births, whatever way to maintain you and your baby to maintain your connection. Keep those cords intact if you can until the placenta comes out. No pinching, no cutting, no clamping. That maintains that connection. They can't take a baby from you if they don't cut and clamp a cord. Keep those babies warm on your chest. Avoid the hats, okay? When all possible, love, smell, stroke, kiss your babies, and envelop them. Hats are fine in a couple hours to maintain some warmth. I get that. But envelop your babies. I want to thank all of you for joining me this morning and knowing that even in my robe, my glasses, my hair hasn't been brushed, that we can talk about what's real and what's raw. All right, I will be on at 7 o'clock tonight. We're going to talk about parenting meltdowns. That means meltdowns in parents, meltdowns in infants, newborns, infants, kids, and we're just going to talk about what happens with a meltdown, why it happens, how to help it, and perhaps some ways to deal with it, especially in newborns. Sometimes things happen. And in parents when you have to have a meltdown. So I hope you'll join me tonight, 7 o'clock. Tell your friends, bring your neighbors, and I'll see you then. And remember, you're amazing, and you can do anything you set your mind to. All right, take care. See you tonight.